everyone, and thank you so much for taking time out of your day to join the NeedyMeds special topic webinar, EyeCare America, Protect Your Sight and Empower Your Life. My name is Carla. I am the Director of Education at NeedyMeds, and before we kick off today's presentation, I want to go over a few tips. You can feel free to type any questions you may have into the questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the chance to answer your specific question, we will follow up with you personally via email by tomorrow afternoon. But of course, we will provide the contact information for both NeedyMeds and EyeCare America if you need to reach out to either one of us sooner. You will also find copies of today's PowerPoint presentations in the handout section of your GoToWebinar control panel. If you have difficulty accessing those, you can shoot me a message in the questions section, and I'd be happy to email it to you after the webinar. Also, I didn't want to forget to tell everybody that today's webinar is being recorded. We will work as quickly as we can to convert it into a video to be posted to our YouTube channel, so you can share it or refer to it at a later time. So with that, let's get started. For those of you that are not familiar with NeedyMeds, what you're looking at on your screen is a slide that lets you know our mission statement, which was actually updated in 2016. Basically, NeedyMeds' goal is to connect people free and anonymously through our website and helpline to programs that will help them afford their healthcare expenses. And as you can see, a big part of our mission is educating people. And we really define education in two ways. One, by educating people about the resources we have to offer, and two, by letting them know about other important resources to help them take care of themselves. What you're looking at on your screen now is a shot of our current homepage, and I always put that up because really our website is the face of our organization. And two quick locations I want to point out on that website. At the top, you'll see a tab on the navigation bar that says Patient Savings. That's where you can find all of your healthcare savings programs. On the bottom right-hand side is our calendar of events where you can sign up for future webinars. And on the top right-hand side, you'll see a bunch of social media icons. The third one from the right is our YouTube channel icon. I'm pointing that out because, as I said in the beginning of this webinar, this presentation is being recorded, and like all our other special topic webinars, will be converted into a video and put on that YouTube channel. I'm pointing that out because it's really a great way to stay up to date with what's going on with NeedyMeds and under other timely healthcare topics. So again, as I mentioned, a big part of the NeedyMeds mission is educating people, not only about NeedyMeds, but by letting people know about other resources available, which is why we are so pleased to have our guest here with us today. It is my pleasure to introduce our panelist, Betty Lucas. Betty has been the director of the American Academy of Ophthalmology EyeCare America program for 18 years. Prior to joining the Academy, Betty spent 20 years helping the underserved by running and designing volunteer programs for nonprofits, specifically in the Bay Area, and designing pro bono law clinics in Alameda County. We are honored to have Betty provide an overview of how EyeCare America works to protect sight, to empower lives, and walk us through the free resources available to you and your loved ones. So without further ado, I'm going to go ahead and pass the mic and the screen to our guest, Betty. Hopefully I'll do that seamlessly. And while Betty is grabbing that screen from us, I will remind everybody, if you do have questions, you can type them into that question section of your GoToWebinar control panel. And while Betty's pulling up her PowerPoint presentation, there we go. The other thing I also want to point out is at the end of the webinar, I will bring to your attention upcoming future webinars, and you'll be able to see what's available or of interest on the calendar for the next couple of weeks. So with that, I'm going to go ahead and pass the mic to Betty, and she will take it away. Thanks, everybody, for your patience, and enjoy the presentation.
Thank you, Carla. I'm going to try and minimize this this screen on the right so you don't have to look at it, or maybe I can
that's
move it
okay,
over.
Betty. Yeah, we don't see your GoToWebinar control panel, so it's not in our way.
Oh, okay, super.
Great. So thanks, everybody. Enjoy the presentation.
All right. There's something in the middle of this that I don't understand. Let's see what that is. Pardon me while I figure this out.
That's no problem.
Maybe.
And to our audience, let me know if you all agree. What I see is just the next slide of your PowerPoint presentation. There's nothing obstructing our view. So if it's in your way, that may be tricky, but I think, and I am getting responses from our audience, that they are also seeing an unobstructed view of your PowerPoint presentation. So from our point, you're good to go. Thanks, everybody, for the help.
Great, thank you. And thanks so much, Carla, for having me here. I really appreciate people attending and listening to what I have to share. I'm pretty passionate about this public service program. It's been around since 1985, and we really, we can't help everybody, but the people that we do help, we're really happy to be able to. So we offer two programs. We started out in 1985 with a program called the National EyeCare Project. And fast forward many years later, we changed it to EyeCare America. We added a program called the Glaucoma Program. So we have our seniors program, which is really the flagship program of EyeCare America, and it's designed for medically underserved seniors who are 65 and older. And our glaucoma program, we realized that a lot of people who were younger than 65, even just younger than 65, who couldn't qualify, were really falling through the cracks. So we created another program called the Glaucoma Program. Now, let me see how I can move this forward. Okay. It seems to be stuck. Let's see. Well, this didn't happen in our practice session, so I'm so sorry. Let's see if I can escape this. Well, we are having technical difficulties. I'm frozen on this, Carla. Do you have any tips? Wait, there we go.
There you go.
So we've become, since 1985, I'm going to talk about the uniqueness of EyeCare America, but we have become one of the largest public service programs of its kind in American medicine today. And we've helped nearly 2 million people, and more than 90% of the care is provided at no out-of-pocket cost. And I'll explain how that happens. So the pilot started in 1985, and the fellow on the right, Dr. Thomas B. Hutchinson, is shaking hands with Ronald Reagan, and that was in I think that was just before 1985, might have been 1984, on the launch of the pilot. We piloted it in a couple of states, and then we went national in 1985, where we had one ophthalmologist who was a leader, who recruited volunteer ophthalmologists all over every state. And then we were able to launch the program to serve nationally this public service program to seniors and people. And then the glaucoma came later. We were introduced to Congress. We've been publicized all over the place, television, radio, but our partners, our key partners, are organizations, large national organizations that serve the older population. So of course, AARP and the National Council on Aging, National Eye Institute, Council on Aging, all different aging organizations. We're very close with Prevent Blindness and Lions Clubs. The Senate and House presented resolutions for our 25th anniversary. In 2020, we're going to be 35, and we're very excited about that. Since this photograph, we've been recognized by every U.S. president. And our senior eligibility is based on the federal government's criteria. We went to the federal government in I think it was in 1984 to see about getting a waiver for our volunteer ophthalmologists to be able to waive Medicare copayments and unmet deductibles for people who might be in some way financially not able to to access that out-of-pocket cost, which sometimes can be the one reason why people don't make that appointment to get a medical eye exam. So under this program, the eligibility is you have to be 65, and the U.S. government wants everybody to be a U.S. citizen or legal resident. And they also consider if you have not been taking care of your eyes or your body, if you haven't seen a doctor in 3 or more years, for our program, it's if you haven't had a medical eye exam in 3 or more years, the federal government considers you out of you're not taking care of your health, especially if you're 65. And so if an ophthalmologist, if you're already seeing an ophthalmologist, we don't need to help you. We want to help only the people that don't have access to a medical eye doctor called an ophthalmologist. So it has to be 3 or more years since a medical eye exam by an ophthalmologist. And they can't belong to an HMO or have eye care through the Veterans Administration for multiple reasons. One is if you have an HMO or eye care through the VA, you can see a medical eye doctor if you have a condition of some sort. And a lot of other insurance does not allow you to be able to. You have to, you don't have access. And so I'm going to move to the next screen. What eligible seniors receive is an eye exam, a medical eye exam, and up to 1 year of care and no out-of-pocket cost for any condition diagnosed during the initial exam. And that care, the no out-of-pocket cost is for whatever the doctor can do in the doctor's office. And then volunteer ophthalmologists, as I stated, they'll bill Medicare and waive co-payments, which is something legally doctors cannot do without this special waiver. And that's what makes us unique. We're the only organization, except for one organization called Copay Relief, that has this waiver. And this allows our volunteers to be able to stay in their office. They don't have to go someplace to volunteer. They get matched by zip code with a patient who is in need and eligible, and then they can provide these services. And so the Office of the Inspector General Advisory Opinion is our waiver, which permits EyeCare America volunteers to legally waive Medicare copayments and unmet deductibles. And so the glaucoma program comes a little bit later because it's for people who really may not know they're at increased risk for glaucoma. And so they do, again, have to be U.S. citizens or legal residents. But in this case, they cannot have they cannot have had an eye exam by an optometrist, an ophthalmologist, it doesn't matter, in 12 months or more. And the other thing that we have to determine is their increased risk. And we do that by asking their questions for their age, race, and family history. And a weighted measurement of that will tell us whether they're at increased risk for glaucoma, and then they'll be able to get an eye exam, a glaucoma exam. And they, again, can't belong to an HMO or have eye care through the VA. So in this case, this program is for people under 65, and it is so it doesn't fall under our waiver, so there's no waiving of copayments because it's only for Medicare copayments. So we have, if you are uninsured, the patient will receive this glaucoma baseline eye exam at no charge. If you're eligible and insured, you'll receive a glaucoma exam and your billed normal office procedure. It's sort of like, just you could choose any ophthalmologist, but we'll match you. And sometimes it gets people to get that one exam and then find out that, oh my gosh, I am at increased risk for glaucoma, and get them back into taking care of their eyes. And we operate on an online basis. In 2010, we moved from a call center to online, and that was pretty early in the internet world, especially for seniors. We were a little concerned about taking this step, but what we knew is that if you have access to a computer, or somebody have access to a computer, we can still help you. And I'll explain more about that. But we asked so they go to EyeCare America's website, and they click on see if I qualify, and then they'll be asked all of the criteria that you see that we've discussed. We have to get their name and address because we match their zip code with the nearest ophthalmologist. And it's not just that one ophthalmologist. If one ophthalmologist in the same area had just had a patient referred to them, our computer system will match to the next nearest ophthalmologist. It could even be the next doctor in the same office, but we rotate our doctors. And then eligible patients will receive a letter with the name of the volunteer to call for an appointment, and the volunteer receives a letter with the patient's name just to let them know that they'll be calling and they are expecting this patient from EyeCare America. The other thing that the ophthalmologist receives is an outcome form, and that tells us what they determined in their exam. And we do this without patient names to remain HIPAA compliant. We just want to know how many cataract surgeries did we do, how many people were diagnosed with diabetic retinopathy or glaucoma. And that's important data for us to be able to share to our funders and the like, and to know how many people we're helping. And so we talked about people without computers. And so there are many ways in which a senior who doesn't have any access can possibly get a referral. Now, if they can't at all, through social workers, health professionals, individuals, friends, family member, we do have an 877 number that is on our website that people can call who do not have a computer. And we also have our old 800 numbers that refer them to this 877 to be able to see if they are eligible. We'll walk them through it. And so it can be anybody, family member, friend, to find out whether or not they're eligible. And it only takes a minute or two to be able to find this out by answering a few questions. We are also updating our website, and we expect in a few months to be able to have an even more user-friendly questionnaire that asks fewer questions to get to the eligibility screen. We work with partners all throughout the United States. I talked about our national organizations, but we also work with churches and local community-based organizations. Every senior center gets free brochures. Any interested group, individual, organization that serves people in need of eye exams can get free brochures, risk factor cards. Our most famous and most popular items are our 2 risk factor cards, one for glaucoma, because they can answer the question, their age, race, and family history, and find out their increased risk for glaucoma right away. And then we have a age-related macular degeneration risk factor card, which has an Amsler grid on it, and they can put it on the refrigerator, and it's a grid that they can just look at and see if the lines look wavy or blurry. They should call their ophthalmologist, whether they do that through EyeCare America or not. So if any of you listening are interested in getting material and distributing it to people in need, you can email us at EyeCare America, EyeCareAmerica@aao.org. And the resources, now we like to help the people we can help, but we know that a lot of people need help out there. And we get a lot of calls from people every day that we can't help, that just fall through the cracks of our system. We'd like to help everybody, but we have to follow all of our criteria. So we offer other medical services list online of links to discount eyeglass resources, and assistance with medications program, which links directly to the NeedyMeds, and Carla will tell you more about that. But anybody that is looking for some kind of eye-related medicine can look it up and see if they might be eligible for these pharmaceutical assistance programs. Our doctors use it too. They print out the forms, sign it for the patient, get those patients who might have glaucoma and they can't be helped further except with medication. They want to get them on those pharmaceutical assistance programs. And then we worked with NeedyMeds in partnership, and we tailored a discount drug card to call it an EyeCare America discount drug card. And every person we refer receives a discount drug card. And since we started this, we've been able to help people save $65,000. And this is not anything to do with eyes. It can be for any prescription that is eligible for the assistance, the discount. And I just wanted to put this latest grateful patient story, but we get hundreds of these throughout the year. We don't often get a patient willing to have herself photographed. A lot of people who receive care from EyeCare America do not want other people to see that they needed anything. And so it's very hard to get photographs. But this is Betty White, who actually is in Oklahoma, and she's with her son and grandson, and everything she was doing limited her life by her vision that she was losing, and she had stopped playing the piano. She was no longer gardening. She really didn't interact much with her son and grandson. And she is now just so happy and grateful for EyeCare America. And the stories just go on and on and on. This exam prevented me from going blind. I don't know what I would have done without EyeCare America. Many of these people might be, house and car rich, but cash poor, and they need that little extra boost that gets them to the doctors. So if you have any emails, or any questions, you can email us at EyeCareAmerica@aao.org. And I think my phone number used to be on this, but I'm happy to provide it to you. You can call me directly if you have any questions. On our website, you can just type in the words EyeCare America, EYE-Care America, and you will find us. It's actually aao.org/EyeCare America. And you can get on the website and click on you can click to get a partner packet, and that will send us an email that you're interested. Just give us your address and we'll send you a sample of all the material we offer. And it will be free, and you can order as many as you want if you have health fairs and the like, as long as our supplies last. So now I welcome any questions from anyone.
Betty, thank you so much for taking the time to walk NeedyMeds users through that informative presentation. And you could go ahead and switch the screen back to me. I think I could actually grab it from you. I hope you and the audience could now see my screen. And as Betty said, certainly submit any questions you have. And you could do that again by typing them into the questions section of your GoToWebinar control panel. And while those questions are coming in, I'm going to take a moment to point out some of NeedyMeds' most cost savings, most effective and popular healthcare cost savings resources. We have a very robust database of prescription assistance programs, and you may be familiar with those. Those are programs that are supported by pharmaceutical companies that offer free or deeply discounted name brand medications to those who qualify. We also have diagnosis-based assistance programs where you can find assistance for healthcare expenses related to a diagnosis. We also have a robust database of coupons and rebates, more than 16,000 free low-cost or sliding scale clinics. And of course, we do have the NeedyMeds drug discount card as a safety net. If you're interested in learning more, join us for one of our monthly overview webinars. And again, you can find our calendar of events and upcoming webinars on the bottom right hand of our screen, which I had showed to you in the beginning of our presentation. I also wanted to take a moment before I turn the questions over to Betty to point out the additional webinars we have this month. One specifically on the financial impact of cancer coming up next week. And later in the month, there is that overview webinar I just referred to. If you're interested in learning more about NeedyMeds, the resources we have to offer, and how to navigate our website, I hope you can join us for that. In the meantime, I'm also going to put up the contact information as promised to both NeedyMeds as well as EyeCare America. And as Betty said, when you go to the website, you simply type in EyeCare America and it'll direct you accordingly. Or you can shoot an email or give a phone call to that number on the screen. So with that, Betty, some of the questions coming in is, one person wants to know whether EyeCare America provides contact surgery with no cost.
What is contact surgery?
Excuse me. Cataract surgery. I apologize.
Yes, we do. I'd say one of the number one things we do is provide the cataract surgery. There are some criteria that I need to mention, though. If the doctor does this surgery himself or herself, it can be at no out-of-pocket cost because the doctor has control in being able to waive the co-payments and unmet deductibles. If it has to be done in a surgery center, the doctors often ask that surgery center to waive the anesthesiologist fees, the facility fees. If that can't happen, then it is the responsibility of the patient to have to pay that. Sometimes they can make arrangements with the facilities to make payments, but cataract surgery is one of the things that we do offer. And we also, it's care for up to 1 year and no out-of-pocket cost for anything diagnosed, so other follow-up care that's needed. And you might wonder what happens after that 1 year. Well, we can't see people for life, but we can get them connected. And sometimes when care can't be provided or the patient can't afford it, there can be resources in the community where the doctor can refer people to clinics or to different services that might exist. Each state is different. It can sometimes be a huge black hole. We can only provide our limited services. I wish we could help everybody, but yes, cataract is one of the main #1 things that we do.
Thank you so much for that thorough response and pointing out the details regarding what can happen when it comes down to the nitty-gritty of payments. And again, just a reminder to our audience that we do hope that you turn to NeedyMeds if you are finding that you're having difficulty affording not only a medication but a healthcare cost. We encourage you to visit our website, but certainly reach out to our expert call center counselors at that toll-free number, which is 1-800-503-6897, and they will do their best to connect you to a program that will hopefully help you afford a healthcare need. Betty, another question coming in, which is a good one, is if there's an individual without health insurance but meeting all the other criteria, still qualify for the seniors program?
Yes, thank you for asking that question. A great question. But of course, yeah, the volunteers agree to see seniors who are insured or uninsured and provide the very same services. So if they have no Medicare, they will be seen at no cost for that initial exam. If nothing is detected, they'll just get that exam for free. If they need the follow-up care, they have dry eye or something else or whatever it is they're detected with, they'll be seen for up to 1 year at no out-of-pocket cost for the doctor's services. Yes, indeed.
Fantastic. Thank you again for that answer, and thank you to our audience member for bringing up, because that's an important one. And I always figure when somebody is taking the time to submit a question, if one person is thinking about it, there's probably a few more that are thinking of the same question. Betty, we have a question coming in from an audience member. Do we pay for the materials? And what I think is being indicated here is any educational materials or applications that may be requested by a patient or even a caregiver on behalf of the patient. Is there any cost that is required for materials?
No, it's all free. That's the most amazing thing that we offer. It's really absolutely incredible. This is the voice of EyeCare America is everyone out there, and you know, you can have things published online and people might not see it, or you can even have you know, radio, whatever kind of television, but the voices of the people on the ground, grassroots, are how people hear about us and find out and see if their aunt so-and-so or their grandma or sister or brother is eligible. So we offer this for free as long as supplies last. And as far as we can see, we've not run out. So if you order thousands, we might have to limit you to a couple hundred, and then please reorder when you need more. But this is all free, and it's we call you our partners. The minute that we send you a packet of information and you order brochures or risk factor cards, anything, you become our partner, and we will be in contact with you the following year to see, do you want to reorder? Did you use all of what we sent you? We get comments all the time from grateful social workers or people, librarians. Every library in the US has our information. Well, anyone that has ordered it, but they've all been sent a packet of sample material. So yes, it's free, free, free. Please order, send an email to us with your address, and we'll get this out to you. And you'll be able to send in, fax in, or send in. We include a self-addressed stamped envelope that you can send back your order form if you can't fax it back to us.
Beautiful. Thank you. And thank you to our audience member for asking that question. And I will piggyback onto that with my own enthusiastic free when it comes to NeedyMeds. The website, our call center counselor, an unlimited supply of educational brochures and materials, as well as our drug discount cards, are not only free, but they're also completely anonymous. And just like Betty said, once you've been a user of NeedyMeds, we consider you a partner as well, because we're looking to you to help spread the word about the resources we have to your patients, your family members, and your neighbors. So Betty, are there any other qualifying factors based on income?
No, we don't ask people's income information because we did actually, I think in the first few years, and people just, to share that information was really too kind of risky, they felt, and that was back in the day, and still today we know that that can be true. So what we're here for, we're not just serving people who are absolutely at their wits' end and have always been poor. Sometimes some of the most incredible stories we get are people who have just turned 65. Some of them have or don't have Medicare, but they literally just lost their job, or they don't have any, they're just cash poor. And it's temporary. We got a comment from a nurse, an RN who retired, and she never had to ask for help, and she was just in a really bad place. But after that, we got a card saying she got another job and she was doing quite well, but she didn't know what she could have done without EyeCare America. So it's just, we don't want to find out about finances. We want people who, if you're 65 and you haven't had an eye exam by a medical ophthalmologist, you are not taking care of your eyes, and you're at increased risk for all kinds of eye diseases. And if you catch it early, that's the key. With glaucoma, it doesn't have often no warning signs, and you can go to an ophthalmologist and get an eye exam, and it can be too late. This happened to my mother. She prided herself in never going to the doctors. And when she went, the doctor said, "I'm sorry, you're going blind by glaucoma, and I can't stop the progression. You waited too long." That's a crime. Her sister, her younger baby sister, 2 other sisters went blind as well. Her baby sister lived till her almost 90, and she could see, but she just got detected earlier and was on eye drops for all the rest of her life, and she could see to the day she died. So it's real important to, be able to have help, and we're here to help people that are eligible.
Great. And do you have to be in a specific state in order to qualify?
No, we have volunteers throughout the states. In some of the rural areas, people have to drive further, but they know that. There are not enough doctors in all the rural areas, but the average amount of miles that people have to drive is 4 in urban areas, and it's pretty accessible. So yeah, we have more than 5,500 volunteer ophthalmologists all over the U.S.
Wow, that's quite an impressive number. And getting back to the packets, can you talk a little bit about what is included in the packets that you mentioned earlier?
Oh yeah, a sample of all of the material. So we have flyers, risk factor cards, brochures that are most popular, sort of cover all the eye disease, seeing well as you grow older, the discount drug card. What else is in it? I think there's a couple of other educational brochures about eyes, floaters and flashers, and yeah, there's a whole list. I'm sorry I didn't bring that list with me, but it's a lot of brochures, risk factor cards, of course, an EyeCare America brochure, and flyer that you could put up on a bulletin board. We limit those to no more than 5 flyers because they're in color and we can't print that many, but you can certainly print as many as you want of those. And yeah, and it's all free.
That's the important thing, is that EyeCare America makes it really easy to not only obtain the materials but spread the word, since all of everything they're providing with is free of charge. And I would recommend to our audience members for just reach out to EyeCare America and ask for a sample packet. I am getting a lot of people writing in who would be interested in receiving certain parts of that packet or the whole packet. So just so you know, we see those comments coming in, and we will be in touch with you by tomorrow afternoon at the latest. And we're going to go ahead and wrap up today's presentation. As I mentioned, if we didn't get the chance to answer your specific question, we will happily follow up with you via email by tomorrow afternoon. Of course, don't hesitate to reach out to NeedyMeds or EyeCare America in the meantime. Betty, thanks so much for taking time out of your day to share these amazing resources that EyeCare America offers. And thanks for our audience for taking the time to listen. Have a happy and healthy rest of the week, everybody, and thanks for your time. Take care.
You're welcome. Thanks, Carla. Bye.